Good morning, and thank you for joining Mitchell County Hospital District for our episode of Ask the Experts. This is Jessica Stone, Community Relations Director for Mitchell County Hospital, and joining me this morning is Dr. Dee Roach, Chief of Staff, and Jennifer Hale, who is the manager of our infection control team. Dr. Roach, recently a couple of local places were labeled as hotspots for COVID-19. What extra precautions should someone take if they need to visit one of those businesses?
Well, first of all, let's talk about the increase in number of cases in the community. First of all, we've talked about this before, and I think it has been completely inevitable that we will see an increase in number of cases. The explanation for that is a combination of a number of things, including increasing the number of tests that we're doing, and so just based on a percentage alone, we're going to see an increased number of cases. Secondly, we do know that since the economy has opened up and people are becoming increasingly socialized now, risk for exposure is obviously going up, and consequently we're going to see an increase in number of cases. We also know that this virus is continually mutating, and it is now considered to be increasingly transmissible as compared to when we first saw this virus. And fortunately, the target population that is currently being susceptible or infected by the virus is the younger population, and they seem to be handling it a little bit more effectively. Regarding what you do publicly, whether it be a business that's been identified as having positive exposure, the recommendations are exactly as they have been all the time. Number one, wear your mask. Number two, maintain social distancing. Number three, avoid circumstances where you know you could potentially be exposed. Beyond that, the things we've talked about repeatedly, make sure your nutritional status is good. Make sure you're drinking plenty of fluids, get plenty of rest, and again, avoid those circumstances where you think you might be potentially exposed.
Thank you. And Jennifer, can you explain the change in the hospital's daily COVID reporting?
Yes, I can. We have decided to go kind of streamline our reporting to match what the health department is reporting. And so from now on, moving forward, we will just be reporting any active cases that we have, the total recovered cases we have, and then the total year-to-date positives. So you will see a fluctuation in the active cases. When those cases have recovered, they will move over to the recovered box. And that's how we'll be reporting from now on.
Okay, great, thank you. And Dr. Roach, can you explain the steps that someone needs to take if they think they need to be tested for COVID-19?
Sure. First of all, we have an excellent resource here, and that is the COVID hotline, 728-3431, extension 7070, I believe is that number. That's certainly a resource that you can get some valuable information from regarding your particular exposure or concerns for exposure. The other option, of course, would be to contact your personal healthcare provider, whomever that might be, and get some direction from them.
Okay, thank you. And lastly, Jennifer, with the increased cases in the county, what do you recommend for people's changes in practices while they are in public?
I just recommend that people continue to follow the guidelines that we've said multiple times, and that's practice social distancing. If you can't be socially distant, then wear your mask and do both if you can. Wash your hands, practice good hygiene at home, cover those high-touch surface areas with a disinfectant and keep those clean, or even warm soapy water. The other recommendation is like maybe if you have a weakened immune system or chronic illnesses that you deal with and you're concerned about going in public places, maybe schedule those visits either in the early hours or the times of the day that there's less traffic in those public areas. And then, of course, if you're sick, stay home. Like Dr. Roach said, reach out to your local provider, or you can call the hotline, 728-3431, extension 7070, if you have any questions. And then, of course, if someone is sick in your household, then attempt to segregate your whole family until you have further guidance on what you need to do. But we're always here to answer questions.
Great, thank you. And thank you, everyone, for joining us this morning.